What's the impact of the coronavirus on children? I asked a group of parents recently. One of them remarked that the rate of infection amongst children was really low and the number of pediatric deaths was a minority. Another mother told me that she was even sanitizing the books that the children had borrowed from school. It's wonderful to see parents so concerned about their children's physical safety and going to great lengths to ensure that they are safe and sound. But today I'd like to focus a little more on the impact that the coronavirus is having on children's mental health and how can we as parents take care of their mental health during such times. So we have these perfectly healthy children who have suddenly been asked to stay at home, learn through the medium of online learning, and have to be very, very careful about their personal hygiene. On the one hand, they are exposed to news of coronavirus on television, on newspapers. They hear their parents talking about the economy shrinking and the possibility of jobs being cut. And on the other hand, they face isolation from their friends, lack of physical exercise, and a downward spiral in the amount of social interactions that they are normally used to. All community parks, movie theaters, schools, swimming pools have been closed in Dubai, and it's probably going to continue in the same manner over the next few weeks. It is highly likely that in your country too, the situation may be very, very similar. So coming back to what can we do as parents to help our children during these times? The first thing is to discuss with them how do they feel about coronavirus. And this means not just the physical sanitation bit, but it's about how they feel emotionally. And you'll be surprised that when you dig a little deeper beyond the exuberance of sudden school closure, you'll find some of them saying, I feel a little scared when I have a sore throat because I wonder if I'm infected. So whatever it is that they have in mind, whether they're feeling a bit sick, whether they're feeling a bit lost, whether they're feeling a bit lonely, help that surface through conversations around how they feel about the issue. The second thing is to provide them with a structure. Now, schools are obviously putting in online learning systems, but homeschooling is much beyond just online learning. While online learning provides the lessons, as parents, we need to ensure that the other element that schools provide, which is a structure and discipline, is taken care of. So sit with your child and co-create a timetable, a structure, which could have various elements like learning, like physical activity, like chores, like activities, like music, different elements, and ensure that you hold them accountable to following that timetable. Discourage any late wake-ups, late going to bed, because whenever there is no structure, the child gets more confused and there is far greater ambiguity and hence confusion. And lastly, limit digital exposure. As children get confined to houses, it is probably easiest to hand them the phone, the iPad, or switch on the TV. Yet this would get them accustomed to a copious supply of digital exposure, and when things return to normalcy, when we expect them to suddenly let go of it, it is certainly going to lead to withdrawal effects. So think of the time when you were kids, which was a bygone era, and how did your parents keep you engaged? Think of your children's interests and draw up activities around them. For older children, it could be like helping them manage the finances of the household using bookkeeping principles. For younger children, the opportunities are even more numerous. So let's help support our children's mental health during the coronavirus care and ensure that they stay happy and healthy.